Owen, who it seems like many of you might already know, I'm sure, as she's locally based in Gloucester, working with GARAS, who are a non-for-profit organisation supporting refugees and those seeking asylum in Gloucestershire. Adele is going to talk a little bit about what's going on in the local area and what's happening in Gloucestershire as part of the COVID-19 response, and also a little bit about the situation in camps across Europe. So we are recording the session now, just so that everybody knows. If you are able to mute yourselves, that would be fantastic, just to keep background noise to a minimum. And feel free to turn off your cameras as well during the main presentation. Adele, are you there? And
I am. Yes. Yep.
Thanks for joining us, and
okay.
And let's start with your first 10 minutes. Thank you.
Well, hi everybody. Lovely to see so many familiar faces, or blank walls now, and it's lovely to be able to talk to you. It's I think this is my second talk since COVID started, so this is a new, not that I haven't done lots and lots of meetings on Zoom, but this whole new world of not actually being in the same room with you is challenging, isn't it? So I was going to talk a bit about what's happened for asylum seekers and refugees during this COVID period. And then I'm going to concentrate particularly on what's happening with Calais. Otherwise, the different camps and things are going to be quite complicated. So basically, as it became more and more apparent that we were going to be locking down, the situation for asylum seekers with and Home Office decision making was that no matter who you were, no matter what your situation, if you were in asylum provided accommodation currently, you would be able to stay. So that's a huge relief and took a huge pressure off our own local asylum seekers and refugees. So even if they were granted or had a refusal in this period, there wasn't a necessity to move on. And that's obviously an incredibly important thing, because trying to find accommodation just now is virtually impossible. There are some, but very, very difficult. The other thing that has become easier is things like claiming benefits, claiming support. You don't actually have to go in person at the moment, because that is not acceptable, and that means that at the moment, life applying for benefits is more straightforward than usual, but post-COVID, they will be expected to meet all the requirements as usual. But that has meant that if somebody has been granted leave to remain during this period, we are moving them onto their benefits as quickly as possible, because that's a more generous financial provision than the asylum support. So that's a good thing. And there have been a few good things. One of the things that has been useful is that across the whole country, the local migration partnership groups are meeting every week online, so we're able to ask questions and get answers quite quickly, and we have somebody representing the Home Office at those meetings. What has stopped has been almost any interaction with the Home Office with regards cases. Now, the Home Office have said that they are continuing to provide interviews and making judgments on decisions, but very, very few. And we have had, in Gloucestershire, we have had absolutely no one go for an interview in this period. We have had almost no interaction with solicitors. A lot seem to have been furloughed, and getting responses from them is even worse than usual. But that may just be that because they're not getting any response from the Home Office, there's not an awful lot to say, but it would be useful if they just said that to us. So the frustration for an asylum seeker of waiting for something to happen continues as it always has done. And that is a huge strain. That feeling of nothing happening is appalling. For those who are homeless or have been sofa surfing, There has been the provision for the homeless, as with any other homeless, to be put up in local authority at local authority expense in some of the hotels within Gloucestershire. And obviously that's a good thing, but it looks like that's coming to an end at the end of this month. So we're already trying to make sure that there are plans for those who will be obviously back on the streets within the next three weeks. So that's the benefits and support. One of the biggest challenges for asylum seekers and refugees during this period has been that, like anybody else who's is in poverty, has been the huge disparity for those with and those without, and the lack of digital provision is enormous. And an asylum seeker does not, for instance, have any internet provision in their properties. That's just not provided by the Home Office. And that means that they'll be used, if a client is using internet, they will be using it on their data, and they'll be using their data up, which is obviously very expensive. That has also meant that the knock-on effect of that is that access to education, which is probably the biggest reason for using internet, particularly for helping improve your chances, is very difficult. The other thing that has been a big issue has been that all arrivals on the VPR, on the Vulnerable People's Resettlement Scheme, stopped immediately in the middle of March, and there have been no new arrivals. It seems to me that if we're expecting people to do a 14-day quarantine once on arrival, actually this is a project that could happen on, because we could work with the support structure that we have in place. I can't see a reason why helping people to arrive wouldn't be a possibility, but that at the moment is frozen, and we will wait to see when that will restart. And we were told by the Home Office to return any properties that we had waiting, so that they've gone back to the landlord. So if we were told that we can restart the programme, we're going to have to go back out and find some more properties. So there's a lot of things waiting for that. On what's happening elsewhere, you may well be aware that right throughout this period and throughout this year, there have been many attempts, many successful attempts to arrive in the UK from Calais and across the Channel. Now that is because the situation in Calais and in France has got even worse than ever. The French have taken a leaf out of our books and created an even more hostile environment than they had before, and are doing everything in their power to break up camps very quickly. People move on, move a few yards, try again. And because of shutdown, because of the situation, and because it's difficult for volunteers to get in, it has been very, very difficult to get food into camps. The queuing is very, very hard for people to cope with. Distribution of food is really challenging, and patience is in short measure. So for the volunteers involved, it has been a really, really difficult situation. That said, as a result of that, people are making even more attempts to go, and instead of the old way of trying to get on a lorry or on a train, they're now taking boats. And over COVID, 1,000 landings have taken place onto British shores from Calais or from the coast of France. Overcrowded, a bit like what we used to see on the Mediterranean. This is a new development, and it's not. Obviously, this is one of the busiest shipping lanes in the world, and people are getting into these tiny little dinghies, overcrowded, and trying to get into British waters. As soon as they're in British waters, maritime law says Britain has a duty of care to bring them in, and so they are arriving into Britain. But obviously, this is an incredibly dangerous route to take, and there's no expectation, there's no preparation for the waves. For instance, the waves across the Channel are far more significant than those in the Mediterranean, so it's a really, really scary situation to be in. But the push factor is so strong. They do not want it to get into the French system, so they are working very hard to get across the border, to get across the channel, because of the conditions. Obviously, COVID has made life much more difficult. There's no medical support in camps apart from what's provided by volunteers. And those who have gone for medical provision within France immediately are then in the French system because they don't want to be in the French system. That's either complicated. But if they get into the French, if they accept French help for medical reasons, they will be fingerprinted and they will be assumed to be accessing the French system. So it's a really difficult decision for people to make. People arriving in Kent are supposed to be being immediately quarantined, and there was quite a strong setup at the beginning of COVID that they would be moving to hotels where they would be alone, just new arrivals in, but that seems to have kind of broken apart at the seams. So I've got a little nudge to end there, but just to let you know, just quickly to say that along with all the other things that have happened in the last few months, you may have noticed that the Dubs amendment, and if you've got questions about what that means, the Dubs commitment has ended, with only 480 children brought to UK on the Dubs amendment, and you might have missed that in the middle of COVID and all the other things that are going on. I think that's my 10 minutes up.
Thanks, Adele. I think that was really interesting, especially to hear about what's going on here in the UK. I mean, a lot of us heard about the response to the homeless people and local provisions around that, but you know, there's a lot of other things that I wasn't aware of, and I'm sure a lot of other people weren't, about casework not being necessarily tackled during this time, and the furlough of different people, and what that has meant for the process. Equally worrying, like you said, about people now making this dangerous journey from Calais themselves, because obviously a lot of the border and crossings are closed down, and going on boats instead. So I've had a few questions in. One seems very specific to what you were talking about, so I'll just put that to you now, and the others I will leave until the Q&A at the end. Also, Miguel has joined us, I think, which is very exciting, so he'll be taking the next slot. I think also Stroud Greens have posted about the Dubs amendment, which you just mentioned in the chat, so if people want to have a look at that, that would be great. The question is from Pam and Chris Harmer. It says, so 1,000 boat landings, when did that start, and what has been the time scale of that, do you know?
So this came from the BBC, so hopefully it's correct. So there were 1,900 arrivals in 220 since the beginning of the year, and that there's been 1,000 landings since COVID, since March.
Okay, thanks. Hopefully that answers the question, Pam and Chris. And if anyone has any other questions, Adele will hopefully be able to stay until the end of the session to have that discussion with us. So thank you very much, Adele. Really appreciate you taking the first slot and starting us off on this international response to COVID session. So next, hopefully, we have got Miguel Polido, who is he works for, he's the director of the Department of Health in Bogota, Colombia, and is responsible for delivering healthcare across the city during COVID-19, which is a city of over 8 million people, and has over 20 years of experience in national and international work promoting and implementing social, financial, and economic policies. So, Miguel, can you hear us, and are you able to unmute?
Yeah, I can hear you.
Amazing. Thanks so much for joining. It's great to see you. We have 10 minutes for your slot. So if you would like to kick us off in what you're doing in Colombia in response to COVID. Thank you.
Okay. Hello, everybody. Yes, we are here in Bogota. I want to share my screen with you. I don't know if you can allow me to do it. because I need they said that I need a special permission to share my screen.
Okay, I think the Stroud Green. Oh, is that you're the host now? Okay, you can do that now. That should be okay.
Okay. Okay, Mark, me pones en la página web. ¿Dónde está? ¿Cómo se pone? Yeah. Okay, can you see now these graphs or maybe no?
Not just yet. If the share screen button at the bottom of the is on a sort of grey bar at the bottom of the screen. Oh, there we go.
Okay. Yep. Yes. We in Colombia, we were so lucky. Actually, now I am the senior advisor for the Secretary of Health. I just changed the position a few weeks ago. We in Colombia, in South America, we were very lucky because we start to learn everything that was happening in Asia and also in Europe. And we start to prepare the country and especially this big city to face the coronavirus. I want to show you these statistics from Johns Hopkins University because we are follow this as our model role and everything. You can see here that we have deaths for 1,000 persons and we have like we can compare United Kingdom and Colombia. That's what I want to do this because we want to compare apples with apples here in Colombia and see how our strategies are getting good results. Also, we have in Bogota another big data, our own data, and we divide this city, the Bogota, which you say before we are around 8 million people. We divide by different neighborhoods in Bogota. You can see here all the numbers for each neighborhood, and we follow this 3 times per day. We have a meeting 3 times per day, and something that we did initially was the lockdown this city. But we have a big problem because the 60% of the population, they don't have jobs, official jobs. You know, the economy was so difficult to put everybody at home because they don't have money to buy food. They don't have money to pay the rent. We start to have a big issue different than COVID. That was the social issue because the city didn't have enough support or financial support for this population. Now, after almost 3 months and follow these statistics, now we are locking down some neighborhoods when we have more cases. For example, Kennedy, the first one, this is right now, we have a police, we have everybody is at home, but the government is sending food, money, they don't have to pay for any bills, but now that neighborhood is completely closed to everybody. Nobody can go there and also nobody can leave from that place. The other thing that we have in Bogota, we start to follow every single day the intensive care units. Now you can see this, the other graph. We have to follow this because we didn't have enough respirators, but that wasn't the big problem here in Colombia or in Bogota. Even if we can get 1,000 ventilators, we don't have enough healthcare people put in the hospital. We don't have intensive, we have a lot of intensive care unit, but we don't have enough people to work there. We need more specialists, we need more supplies, and the problem, like the rest of the world that we're thinking about respirators, we have the same problem, but we have something extra that was, we need more doctors, we need more nurses, we need more professionals. The other thing that we did here in Colombia was put some restrictions at the beginning. We, in Bogota, some days the men can go outside to buy supplies and everything, and the next day can be out the women. No, everybody can go at the same time, because we found that some families they were going out, everybody with the dogs, kids and everything, and the government put this new regulation. Some days can go the men, some days can go women. And that was very important, because the main thing is social distance. We try to keep the city empty, not with a lot of people outside. And this policy also was very good. Here, after 3 months, we decide that now is not the best policy, is the social distance, washing hands, put some restriction in public transportation, because we saw that the big problem, for example, in other big cities like New York, was the metro. And we have here the public transportation similar, the name is Transmilenio, and we put restriction there to keep the social distance between people. All these decisions by the government are so difficult in Bogota to implement, because we don't have enough social support for people to keep them at home. After 3 months, people are so tired in this city. You know, this is a city that everybody wants to go to work. The people need to find money to pay all the things that they needed. And now the population starts to demand that they want to go outside. And that's the big controversy between the local government, which is Bogota, and with the national government. We start to work as a team. That was another very important thing. Work between the local government and the national government. But now this is the big issue here. We don't have a high mortality yet. We don't have problems with intensive care unit 100%. We are still having beds, but Bogota is going to face the reality in the next 2 weeks, because starting this coming Monday, everybody can go out and work with some restriction, but now the city is going back to the new normality, and we'll see the outcomes in 2 or 3 weeks about that. This is the thing that we are doing here in Bogota.
Okay, amazing. Thank you very much for the talk and the little presentation of the different graphs and things and the data that you've been using to help the people of Bogota and keep COVID as minimal as possible. I think one really interesting thing that you mentioned was the social issues that came from lockdown. It wasn't just about you know, the medical side of things, but then people not having maybe permanent jobs and not having money for rent, and what the impact of that was on families as well is really important, I think. I mean, I think in England here we're going through the same sort of thing with restrictions lifting, and we're not knowing the impact of what that might be. I think Lynn had a question, but I think you answered it at the end, was around local government ministries and the national government working together, which I think you said has been working quite well, which is been interesting. Matthew Brown's also had a question about about domestic violence and how people staying at home. Do you think that that's caused an increase in that? I know that in England we've seen a big increase in domestic violence, which has been a really sad result of all of this. But how has that been in Bogota?
That was exactly the same. They rise around the 30%, and we increase, and we have now like a new TV commercial and advertising, and we define a special like a 911 number because sometimes now they have the problem at home, but now they cannot go out, and they don't have the special friends to talk about that. And that was a big problem here in Bogota. And we start to work with some communities, a special hotline to people can call, and with special words also, you know, sometimes they cannot call and say, please help me. We put the something that we found in media, like, can I get a pizza, or can I get something like that? And the authorities immediately will know that the person is in problem or in danger.
Okay, thank you. Thank you so much for joining us and for answering the questions. If you're able to stay on, we'll probably have some more questions at the end that will be relevant to the work that you're doing.
That's my pleasure. I will be here. Thank you.
Thank you. Okay, so next, hopefully we have Dr. Yixian's son, who is joining us from the University of Bath, where he is a lecturer and assistant professor in international development. His research looks at environmental politics and sustainable consumption and production in the global south. He's recently been looking at China and it as a large emerging economy, and what the impact of COVID might be on economies like China. Yixian, are you there? And can
Yes,
you
I'm here. Can you hear me?
Amazing. Thank you for joining, and your 10 minutes starts now. Thank you very much.
Okay, thanks, Jenny. Thanks for having me. It's really my great pleasure to join this panel. And I know we have so many things to talk about China, and I really want to share a lot of thoughts about China. But what I'm going to do in the next time is I'm going to talk 3 things. But the first one is try to summarize the key features of China's responses to control the virus, especially domestically, how the country has been able to control the virus since its initial outbreak in January. And secondly, I want to look at the political ramification of this pandemic and how it has impacted the relations between China and the rest of the world, especially the West. And as we know, in the UK, we have the discussion about like reconsidering relationships with China. So why this has happened. And lastly, I want to look at how the pandemic itself has reshaped China's global role. As we have seen, like China has provided a massive assistance to other countries, and what's the implications of this new move. So let's start with China's responses. So let's go back to the 23rd of January, so when the Chinese government decided to lock down Wuhan, the epicenter of the COVID-19. So what the government did is very strict, drastic measure to lock down the city. And in the next 2 days, the whole country basically began to enter lockdown as well. So there was also a national campaign to fight against the coronavirus. And in terms of the stringencies, so people are asked to stay at home, so no outdoor activities. So every family, only one person could go out for essential grocery shopping maybe once every few days. And civil servants were sent down to the street and community level to check if people comply with the rules. So very strict compliance. And if you go out, you have to wear masks and checkpoints of temperature everywhere. So if you go to supermarket, or you have to check your temperature. And this is quite aggressive measures. And what we have seen is like after continuously implementing these measures across the whole country for around 5 weeks, the flat began to be flattened. And so by around the end of February, early March, China has already begun to recover from the virus. And so when the WHO announced that the COVID-19 is a global pandemic, by then China has already starting to recover and also slowly to ease the lockdown since later March or early April. So now more or less everything get back to normal, though there's still some restrictions. But so when experts look at the experience of China, even Western experts, they conclude that these aggressive measures have actually slowed the coronavirus and worked very well in China, but may not work in other countries. I think the reason might be twofold. The first one is a cultural factor. And there is a strong like collectivist culture in the Chinese, in China, but also in East Asia more broadly, and people are willing to make personal sacrifice. In this case, especially the personal freedom. Yeah, it's the whole China lockdown. Yes, I'll come back to this later. So I'm coming back to this. The two reasons. The first one is more about cultural factor, especially to sacrifice personal freedom. So people didn't go out for more than a month, just stay at home, really stay at home. But then also the capacity of the government to implement these rules, and this may lead to the authoritarian nature of the government. And so it worked in China, but then it has also impact on like international relations. Here I want to move to the second topic on the political implications. I think the whole dynamic has changed since, especially when the US President Donald Trump called this a Chinese virus in mid-March. And it seems that more and more criticism against China about not only because the initial break was in China, but also there was a cover up by the local government at the beginning about whether there's a person-to-person transmission of this new virus. So the government could not deny that there was some cover up. And in addition to this, there was, because of the authoritarian nature of the Chinese regime, so China seemed to become a perfect scapegoat of like the inability to control the virus in many other countries. But I would like to encourage us to put this into the broader context of global politics, especially the growing tensions between China and the West, especially between China and the US. And we have seen the trade wars since 2018, and also the investigation of Huawei, the Chinese telecommunication giant, by the US in the last 2 years. So this is the whole political dynamics as the Trump administrations see China as a potential rival, a strategic rival, and they're also a domestic audience, try to call for tougher policies against China. So if we put this into the context, I think it's understandable that politicians use this rhetoric and also even call for like decoupling with China. But then if we look at the reality, I would say it may be not possible to completely decouple the global economy with China, and it's also it will be also detrimental to global development. Just put this into the discussion about green growth. I think we are talking about potential economic recovery after this, and then China has a very important role in the global supply chains of renewable energy, for example. So if for other countries it's not beneficial, also impossible to restart from the scratch to build infrastructure. And in order for like green transition, I think China will still play an important role. And then I think this move to the last thing, but not least, I want to discuss about how the pandemic has reshaped China and China's global role. as we have seen, there are so many criticisms against China about especially the initial responses of Chinese government. And to respond, we have seen China has still taken a very cooperative approach and to support the multilateralism in this pandemic. And I would say this is followed kind of the Chinese international development policy in the past. So continuously to support the global cooperation. And there was a concern about whether China would limit the export of key medical equipment or pharmaceutical products. That was not the case at the end. So China still continuously support other countries. But more importantly, I think on an unprecedented scale, we have seen that China started to provide international development assistance to many other countries. I think this is the first time in history we have seen not only China that provided assistance to developing countries, but also to many developed countries like Europe. We have seen China send the PPEs and even a medical team to Italy on the 12th of March. So there are lots of discussion and debate about the growing influence of China. And here we have to acknowledge that because China's capacity and the early recovery of the country from the virus, and also many other countries actually made requests to the help of China. So I think this is one set of story. But on the other side, a lot of people also, like observers, believe that China is taking advantage of the pandemic to increase global influence. But in that regard, I would say it seems that the Chinese government faces a conundrum, a very difficult position because of all this criticism, and China seems to have no choice to continue to provide support. That's why we have seen that it has provided assistance to 115 countries and pledged the $2 billion USD development aid in the next 2 years, and also announced that the vaccine to be developed by the country will be a global public good. So I think the question remains is whether this is a planned strategy of the Chinese leadership to increase global influence, or it's like under pressure from the rest of the world to take the responsibility. I think I'll be happy to discuss more in the Q&A. I think I'll stop here, and if you have any questions, feel free to ask.
Thank you, Yixian. That was really interesting take on China and its intentions, and I think its recovery. Like you said, I mean, when you mentioned that when the WHO was just announcing that we were in a global pandemic and China is already entering into its recovery, the ability for it to do that, the way that you know, it governs and all of those things have an impact on that response rate, comparatively to the Western world, where we've seen a very slow response maybe, and now a premature relaxation of restrictions and things. So I think that, you know, a lot of what China's done has had a positive impact in terms of fighting the virus, but like you say, how do we know what the intentions behind that are? Very interesting. Thank you very much for your presentation. We had one question which I think you answered straight away, but if anyone has any other questions as we go through the next presentation, please put them in there. So hopefully Fariba is still on the line, Dr. Fariba Alamgir, who is a postdoctoral researcher at the Centre of Development at the University of Bath as well. Just total coincidence, I think, that we have two people from the University of Bath. Fariba, researcher, focuses on conflict over resources, local politics and dynamics of authority and state formation. She has an interest in research on how people's struggles over resource rights and entitlements related to identity politics. I think today she'll be covering COVID-19, the impact on the Rohingya community, displacement, human rights, and a whole load of interesting things. So Fariba, are you there?
Yes. Hello.
Thank you so much for joining us, and your 10 minutes starts now. Thank you.
Okay. Thank you for the invitation to join in the discussion, and thank you all for joining us. Yes, as Jenny said, I'm going to talk about the Rohingya displaced population groups who are currently staying in Bangladesh. So I'm currently doing a collaborative research project that aims to explore the displaced population groups' access to mental health services in their refugee camps. So in Bangladesh, we are trying to identify the barriers and the opportunities of the Rohingyas to access mental health services. And we are also investigating it from a gender dimension. So good for our project that before the lockdown started in Bangladesh, we managed to collect data for our research, but we haven't analyzed. So I'm not going to present on our research project, but I'm going to actually highlight some of the vulnerabilities that Rohingyas are facing in Bangladesh by being a displaced population group. And I would also like to highlight the fact that these vulnerabilities that we see now are actually, or these challenges and vulnerabilities were pre-existing and which have become more obvious and escalated during the pandemic, and which I think is all the more reason why we need to reflect on those and think about how to address those. So the Bangladesh government started to respond to coronavirus since the last week of March, and it imposed a nationwide lockdown. And it is at the same time when they imposed lockdown in the Cox's Bazar district, where the Rohingya refugees are living now, in the camp, which is referred as one of the largest and the fastest growing refugee camps in the world. So most of the Rohingyas who are living there, they are like about 1 million. Most of them were migrated in August 2017 by being forcefully displaced by Myanmar government and because of the violence carried out by the military. So most of them arrived around in 2017, and since then they're living in the camps. So there are certain vulnerabilities that they are facing, which is common, like other population group in different parts of the world are also facing, like living in a very overcrowded situation. But in Bangladesh, it's more overcrowded than any other place, probably 40,000 people per square kilometer who are living in the camps. And they have shared water resources, communal toilets, and shared water facilities, washing facilities, and all this make their situation, they're more vulnerable, and it is impossible to maintain any social distancing. But what I would like to highlight the particular vulnerabilities that the Rohingyas are facing. And these are basically based on the media reports, national, international, and also local, like local dailies I've been following, and also reports of the humanitarian organizations and humanitarian actors' blogs and their appeals. So there are 3 issues that I would like to go through. And these are, one is about the ban that Bangladesh government has put on Rohingyas who are living in the camps, access to internet. So, and then the second issue is a tragic incident which is right now happening as we are talking, that Rohingyas being stranded in boat, several hundred, who've been turned away by Malaysian government and Thailand government, and now Bangladesh government is also refusing to let them in. And the third issue is about the health intervention and tension between host and the displaced communities, and how can we think about vulnerability. So the first issue is about the restriction on their internet use. So this has started since August 2019, so it's been more than 10 months now. So since the pandemic has started, all the humanitarian organization, rights organization, they're appealing to Bangladesh government to lift this ban, because this is obstructing circulation of crucial information about the symptoms and prevention, and also the intervention they're trying to put to effectively manage the situation and to continue conversation among themselves. So according to reports in media and everything, that in the absence of mobile and internet, lots of rumors are spreading and community people are not receiving updated information. And they're also unable to stay connected to their friends and families. So this last point came out very strongly when I was discussing with the Rohingya volunteer who worked with us in our research project, who said that many of us, we have still families in Myanmar, and we have families in different parts of the world, Malaysia, Thailand, UK, US, and we cannot contact with them. And so it is very creating anxiety. So, so there in this context, what is important is to understand the right to have the connectivity and the right to have access to necessary information or human rights issues, of course. And I think we can all agree the importance of being connected is very important for everyone's well-being during this uncertain time. But what I would like to elaborate on this issue is the issue about the spread of rumor because of the internet, limited access to internet or internet blackout, because this has been always an issue. Even before internet blackout in Rohingya camps, distributing accurate information or ensuring their access to such information were challenging. Because when I started doing fieldwork 2 years ago, the UNHCR with the Bangladesh government started the biometric registration process. In 4 months, no Rohingyas were turning up to the center to do the registration because there were rumors that if they do get the biometric registered, they would be sent back to Myanmar. So it took months to make them, understand or, circulate information that how this is going to help them, or they will have an identity card which will be helpful and all this. So, this has been a persistent problem. Anyone I talk to who worked in gender-based violence or human trafficking, they all always say that one of the main problems they often face is to deal with the mistrust to authorities, or the also miscommunication or misinformation and rumors. So there is an absence of communication networks, and not absence, but there are problems probably, and there are also other barriers like language barriers which have been reported. But what I also like to emphasize that I think that a major barrier in building communication with the Rohingyas is the absence of adequate knowledge about their way of life. They have been here for 3 years, actually more than since 1970s, they've been migrating in different times, but there is very limited knowledge about their social structure, their political organization, gender relations, ideologies, or the knowledge about their identity construction and history. There hasn't been any study about the historical and contemporary processes of their migration, their interaction with Bangladeshi community, their experience and everyday interaction with the state practices, humanitarian actors, and other practices. So also there are not awareness or even adequate knowledge about the dynamics of power relation or the informal authority structure within the community that settle conflicts between families and groups. So what I would like to stress here is that probably this is one thing that is needed for effective communication, the adequate knowledge, and engaging with parallel or informal power structures which can help. And related to this point, I've also observed there is 2 opposite images of Rohingyas among the host community and also humanitarian actors. They would often discuss talking about Rohingyas, they would say they're aggressive and violent, sometimes backward or uncivilized to the point that they don't know what soap is and they would eat the soap thinking it was food. On the other hand, they would also say that Rohingyas are like their Rohingya friends or their colleagues are very reliable and cordial and loyal and hardworking and grateful. So in my observation, this opposite images of the Rohingyas is kind of persisting, and which needs to be resolved or addressed. And for that, we also need adequate knowledge, because it is in the absence of the adequate knowledge that this negative and derogatory images of the Rohingya are persisting. And that would be necessary for building effective communication. So I think the time is up. Shall I cover another point or just?
If you would like one more point, that would be fine, and then we can.
Okay, so right now while we're discussing, actually, there are a boat full of like 300 Rohingyas who are being stranded in close to the shore of Bangladesh. So they were being trafficked. So they paid the trafficker like from $600 to $1,000 to have a passage to Malaysia. But then this is a recurrent event. It happened in April, and now it's happening again. So so when they reached Malaysia, the pandemic also already started, and the security was so tight they couldn't land there. So for days they were in the shore in the sea, but none of the countries, Malaysia, Thailand, or in Bangladesh, were taking them in. So after 2 weeks, Bangladesh let them in, but this time Bangladesh government is again saying that we have taken too much of the responsibilities of the Rohingyas and we are overburdened. We are neither obligated, like the Prime Minister said, neither obligated nor in a position to take any more Rohingyas. So one of the commentators just said that Bangladesh government can take this stance, as well as other governments, I think, because they are not signatory to the UN Refugee Convention. So they're not obligated to adhere to international guidelines. So what I'd like to point out here is that this is a big problem, because Bangladesh is not giving them refugee status because it's not signatory, and also not accepting the situation as a protracted displacement, rather taking this as a temporary situation, which is putting some barriers in the work that these aid agencies are doing, their service deliveries. But however, the problem, the vulnerability the Rohingyas are facing actually start from the citizenship law of the Myanmar government, which was designed in 1981, which made them, took their citizenship rights and made them outsider in their own country. And the Rohingyas, as we can see, they don't want to live in Bangladesh actually. And like they are trying to get, many of them try to get out because of having very good opportunities. And actually, when I was talking about mental health conditions, one of the person who has some mental health conditions and his psychologist told him not to worry or stress. So he told us that, how can I not worry? I always worry that, what if I die here and I'm buried here? I don't want to die here. So what they actually want is justice, and for the genocide being carried out, what they want is the citizenship right in Myanmar. And what we can see in the last 3 years, the international government and the community are completely failing in creating any legal framework, institutional mechanism, or putting any pressure on the Myanmar government to revise their citizenship law or guarantee safe return of the Rohingyas. Sorry.
Thank you so much, Fariba. No, that was, I mean, an amazing presentation, and thank you so much. I mean, I know that in every country, the COVID response and the impact on mental health is huge, but for the Rohingya, it seems like even more so, and that their plight has been a lot longer than the impact of COVID, and that you know, a lot of these issues, like you mentioned with the ban on internet access, has been since a long time before that. And I think that without up-to-date information and you know, knowledge that you can trust, it's very difficult to adhere to some of the restrictions and things that you need to do in order to avoid the virus. So like you were saying, on shared sanitation and you know, washing of hands and availability of water in these refugee camps, that without, you know, knowing the impact of the virus or what it means, it's very difficult to adhere to those things. So thank you so much for your presentation, and really appreciate you joining us. Hopefully we'll have some interesting questions to pose to you. So thank you everyone for listening and engaging and sending through your questions. So I'm going to go back to the top. If people can remember the questions that they asked and want to come on when I mention your name and ask them yourselves, then please do. If not, then we can. Then I'm more than happy to read them out for you. So Marina asked a question which I think will have been to Adele in its initial posting. Marina, are you there?
Yes, I can't find my camera, but I think I've unmuted myself.
Yes, you have. We can hear you. Thanks.
Yes, I was wondering what happened to the people who are or were in indefinite detention in the in Yarlswood and places like that.
So, my understanding, at the beginning of COVID, there was a huge campaign to get people out of detention, and some were released from detention, but my understanding is that by no means all detainees were actually released. One of the problems was finding places for them to go. Obviously, that, you know, that's imperative, and the Home Office with the housing providers have had to work quite hard to provide hotels and odd places, pick up new accommodation, because the numbers have gone up because they haven't got a flow through. People have got stuck in accommodation, And my understanding is that no, in the end, most detainees remained in detention. But I can find that out, Marina, and let you know.
And are
Thanks, Adele.
they still
Right.
detaining people?
They haven't been through this period. The Home Office has done almost nothing, really, in as far as any kind of casework or any kind of. Certainly, nobody from Gloucestershire has been detained in the last few months.
Okay, thank you very much, Adele, and thank you to Marina for asking the question. So scrolling down, Lucas also had one, which I believe was for Adele. Lucas, are you there? And would you like to unmute and read your question?
Just a point of clarification. I think landings means people having landed, not boats. It says 1,000 boats. I think it's since COVID started, 1,000 people have landed. That would correlate to since the beginning of the year 1600 or 1900, as you said. But maybe I've got that totally wrong.
Lucas, I'll look into that. That was my understanding. I was listening to the BBC report, but I can check. As I say, I've got this meeting tomorrow, the weekly meeting, with, and there'll be somebody from the Home Office. And certainly every week he talks about the numbers that have arrived in the past week.
Yeah.
But
anyway.
there's several boats. I mean, it says several boats a day, and that number's been going up. But as you say, that seems an awful lot. But then 1,000 doesn't sound quite enough either. I will check it up, and if I can come back through Jenny, or if you want to send me your email address,
okay.
I can investigate that. But because 1,000 people doesn't sound big enough, from what my understanding is. Kent has been taking hundreds and hundreds. So I will try and check that fact for you.
Yeah. Blimey.
Okay, thank you, Adele. And yes, definitely send us any information that you've got, and I'm sure that we can get it up on the website alongside the recording of this session. So just scrolling through again, Lynn, I wondered if you wanted to come in and expand a little bit on your question to Miguel about government ministries working together. Are you there?
I am here. Can you hear me?
Yeah, can hear you.
Yeah, I'm curious about whether the national government in Colombia and maybe Miguel has some information about other countries in South America, but whether, and Brazil is a whole separate case. Brazil, I feel like, is in the same category as the United States. But even here in the UK, the kind of coordination between the central government and local authorities has not been very good. And there's been a real lack of leadership, I think, on the national level. And so I wanted to know from Miguel, and perhaps about some other countries in South America, if he has information, how that has functioned.
Nice question. At the beginning, we have a very big issue in Colombia because all the governors and mayors, they try to do new strategies, new policies in their own towns without a good information. People was kind of scared or desperate to find solutions. And something that was very, actually some towns trying to close the borders and don't allow to go any other Colombian inside. That was like 3 or 4 days with a lot of new regulations for each town, for each mayor, for each governor. But something that was very important was our president, he put a special law that go to the constitutions and say, hey, listen, here we have to work as a team. The manager of that team or the coach of that team is me, the president, and we are going to do these things together and put a lot of restrictions to the governors and to the mayors. And they start to work together. They start to have special meetings using Zoom or using the new technologies. And that was very important. And I think that was part of the success of the strategy here in Colombia. with one important thing, you know, it's like if you want to work with us, we are going to buy all the special needs like respirators and other supplies for the hospitals, and everybody start to follow the president, because that's the constitution, you know, the main person in Colombia is the president, and now all the regulations that the governors want to put in place, they have to consult with the national level with the president. That's the success. Yes, I don't have a lot of information about Brazil. The only last news was like, for example, Johns Hopkins, they don't want to follow the statistics for that country from Brazil because they don't trust in the information that is public right now. But I don't have information about Brazil. We have problems. We have problems in Colombia because we have 5 different countries we share borders. One of those is Brazil, and people from Brazil start to move to come to Colombia to get medicines and to get health services. The other problem that we have is with Venezuela, which is not because of the coronavirus, but we have a long history with Venezuela with problems in the past few years. And we start now to, people from Venezuela wants to go back to the country, to Venezuela, but Venezuela closed the border. Now we have a lot of people from Venezuela waiting to Venezuela open the borders to go back to the country. I have another question from, that was asking me, I think.
Yeah, I think it's from Kirsty, about, has there been an impact on the payments from families who are in other countries like the US, who send money back to Colombia, because obviously the US has seen a big economic impact from COVID as well.
Yeah, actually the economic impact is worldwide. Is about everything, and this is and this thing is also one of those, because people want to stay at home. They cannot go to special places to receive that money, and Colombia didn't have in the past a good internet connection, you know, to make this transaction online. Now the government start new process to people can get this money through the bank accounts and not going outside, because the first thing, we are locked down. If you are at home, how can you go to get your money? But that was a problem. But yes, completely. The reduction of this indicator was very big here in Colombia. We are not getting money from our relatives from other countries, not even from USA, also from Europe and other countries. Yes.
Yeah. Okay. Amazing. Thank you so much for answering the questions. I'm going to keep looking down now. I know that Yvonne has asked me to read hers out, which I think is for Yixian. Can you say more about the cultural collectivism and willing sacrifice of personal freedoms? And then I will come to Sarah's question after that. Thanks,
Okay.
Yixian.
Yeah, great question. I think, yes, it sounds like a cliche when we talk about the differences between the Western culture of individualism and then the Chinese or Eastern Asian culture of collectivism. But actually, I think if we look at this case, the crisis, and actually I think the collectivists matter, especially the first, I think I want to highlight 2 things. The one is the support at the community level, so people try to help each other. But I think we have seen this also in the UK. I mean, I live here during the whole pandemic, but I think we often think, okay, because in China, a lot of people still have the memory that living in big families, but also like people working for the same companies or factories live together. And so I think people help each other, and especially during the lockdown, I think that we have seen a lot of examples, people help each other just spontaneously and voluntarily. So yeah, I think there was no like kind of movement and organized activities. So I think we have seen like very spontaneously a lot of cases, and this is just based on what I heard, also some personal observation. But also another thing is, if we look at the policy, when the governments announced the lockdown, there was no like social policy package. It's different from the case in the UK. We had to announce very early the full of schemes and try to make sure that everyone will get to ensure their income. But in China, that was not the case. And then the campaign is just, this is a national crisis. Everyone should help the country to fight against this crisis. And people, this was said, I think that was the disadvantage of this style of responses, but actually a lot of people accept that, and then they said, okay, we all have to sacrifice, even we just accept some personal income loss. A lot of small businesses had to be bankrupt as well. So I think that was very unfortunate. So now governments start to try to think how to help people, and yeah, maybe launch some stimulus packages, I think, gradually. And the other example I want to give is that it's about Chinese overseas students, because when China started to be recovered from the crisis, and a lot of people feel like China is safer, and there are so many students, maybe we already heard that in the UK, in the US, they want to go back. And this, there was kind of like massive movement, people go back, and all airports run out of capacity. And then the government now they restricted the airplanes, so I think very few people could go back. But then they also launched a campaign to the students that saying that just to help the country, don't go back if you can still live outside of the country. And I think that kind of discourse also worked among like Chinese overseas students. Some people say, okay, if we are okay, we don't need to go back, don't be panicked. So I think that kind of the cultural aspect play out as well, the cultural factor, I would say. Yeah, so I hope I answer the question.
Yeah, definitely. I think that's really interesting about in the UK, the response was that community approach and helping each other, whereas in some other countries it's that's sort of a built-in thing that is a standard practice. Okay, so Sarah, did you want to unmute and ask your question?
Trying.
Oh, sorry, Sarah. Yeah.
It's a rather hairy Sarah, I'm afraid. I don't have much to add to my question. Only that at the time that Trump decided he'd bin the WHO, above Bill Gates, the USA was the biggest contributor to the WHO, and China wasn't on the list. So, you know, if you throw your toys out of the pram in terms of influence, it seems that anybody can pick them up. And why not? Why wouldn't China pick up that influence?
Okay, great question. Thanks. Yixian?
Yeah, I think it's a very interesting question. I'd like to talk about this. Actually, I think my background it's international politics and in international relations theories. We have this question about power transitions. So one country was in a leadership position in global politics, and then another country rising into prominence. And then I think that's we are kind of situation we are facing now. We have seen the rise of China and also the decline of the American leadership. And the question is whether we will have a kind of peaceful transition, or both sides can accept the roles. I think that we look at the two sides. So on the one hand, the question is whether China is ready to take the leadership. I think as I already discussed in my introduction, I think we don't know yet. And also from the perspective of the Chinese leadership, the government, I'm not 100% sure. It's just like the pandemic, the whole crisis, this crisis just accelerated this process of power transition. But I'm not sure if China has already a strategy or plan to fill that gap. But on the other hand, we have also the questions whether the rest of the world is willing to accept a new leadership. I think this is even more controversial, especially because of the nature of the Chinese regime. I think it's not a democratic regime. We have to admit that. And then I think a lot of people would question about the nature, if China takes the leadership, the nature of that leadership. And I think I can understand that kind of fear. So I think we will see how these dynamics will continue and in the next few years, I think. But it's an interesting time to observe this change in international politics.
Yeah, absolutely. Thank you for that, Yixian. Definitely. I mean, we could have a whole cloud cafe just on that one question, I think, couldn't we? Okay, so a quick question for Fariba from Martin and Liz. Martin, would you like to unmute and ask your question?
Thanks, Fariba, and welcome. Very glad you could join us today. My question is around the social distancing in the Rohingya camps and what is possible. Have the authorities in the camps or anybody else tried to introduce it? What is possible and what is not? What has been perhaps successful and what has not been successful?
Thanks. Fariba, are you able to unmute?
Thank you for the question, Martin. I mean, I haven't seen much in the media and in the reports about social distancing in the Rohingya camp. But what I know is that, as I said already, that they live in a very overcrowded situation, like 40,000 people per square kilometer, and usually the shelters are like 10 square feet or something, and often families of 4 or 5, you know, quite big families that live in the one shelter. So I know that what have been tried is just to kind of restrict them from social gathering. So like a restriction of going to the mosque and pray, or other kind of religious rituals into which people join, or restrictions to sit in the, usually they sit down in the tea stalls and have chats, and this kind of social gathering were restricted. And also government ordered all the, except for the health organizations, all other organizations to reduce their capacity by 80%. So capacity means the work capacity, or the people who are working. So so apart from the health organizations where people are still working in full capacity, in other organizations only 20% of the workforce are available, or they're actually providing services. And the reason is that because like people who work in gender-based violence programs or trafficking, with whom I'm quite put in touch with, and they run some awareness campaigns, and which are not possible to organize, maintaining social distances and this.
Okay, thank you. I think it's fascinating to think about how some of these things that are implemented in our own countries that we take for granted or don't really consider, how it is impacting people in very different circumstances, like the Rohingya in those in refugee camps across the country or across the world. So there's another question from Martin, which I think is posed to Miguel, Fariba and Yixian, and then we have one more from Yvonne for Adele. So Martin, would you like to just come back in and ask your question, and then we'll have a final one for Adele from Yvonne, which I'm more than happy to read out for you, Yvonne. Thanks, Martin.
Thank you. Yes, and I'm working on a program looking at the impacts of COVID across 8 African countries, but we haven't really got any results yet, so I can't tell you about them. But one of the things that has become clear is that the citizens in Malawi and South Africa have legally challenged their own government's lockdown rules because their governments aren't providing the means of survival, a bit like Miguel mentioned earlier. And they've actually won in the court that the lockdown is unconstitutional. And I was wondering if there's been any similar attempts in any of your 3 countries.
Okay, let's go to Miguel first.
Yeah, that's a big challenge because we are not a rich country. You know, we have limited resources and financial resources, but the government, the national government and the local government, they are trying to do the best to provide these people with special help, special food and things, but never will be enough. You know, you know, the governments everywhere have a limit resources, and we cannot share all the time for every reason. But this country is trying to do the best since the start of the pandemic from the national and the local government. Something that start to happen, and is also good to point right now, is something sad because the corruption. Some governors start to take advantage of these situations and trying to overprice the things, and that's sad. And the good thing is, like, now the social media and people can record and start to show to the rest of the country, look, in my small town, this mayor is buying the tuna or the rice 10 times overpriced than the regular thing. We have a social control which helps to control these resources. And yeah, but at the end, never will be enough. That's the question. Even if we are doing good things right now from the national and local government, never will be enough. Plus, if corruption is around, that will be worse.
Okay, thank you so much, Miguel. Yixian, would you like to come in on China on that?
Okay, thanks for the question. I think it's interesting for me to know legal challenge happened in these African countries, but I think just to my knowledge, I think legal challenge, I don't think that happened in China, although it's very unlikely to happen. But I think we have to acknowledge that there were lots of criticism during the height of the pandemic, the COVID in China, about the inadequate implementation of the government policies. And for example, that patients suffering from other diseases could not get treated because of the hospital was used for like fight against the coronavirus. And so there were a lot of discussions online in China, though, I mean, we know there's a censorship, but still, I think also some medias also challenge some measures. And I mean, because it's a huge country, there are always a lot of problems. But I think legal challenge is interesting. But yeah, I didn't see that. To my knowledge, I'm not aware of any. I'm also interested if that happened in other like developed countries, the European countries. I mean, it's quite interesting to know this case actually.
Yeah, absolutely. Thanks, Yixian. And Fariba on Bangladesh and any comments?
Well, I agree with Yixian that it's really interesting to know about these cases. Yes, there hasn't been any case of legal challenge, any section of the population legally challenging government for what is happening and their responses. And like Miguel said, in Bangladesh too, like government is is providing some kind of food and food subsidies and distributing food to certain vulnerable groups. In villages, those are run through the local, those are given by the local union councils. But in the urban areas, there are a lot of people who live in the slum areas and work in the informal sector, and they are not being provided with the same kind of food ration and all this. But so what we have seen actually, I mean, it's really, yeah, like even in this pandemic situation, we have seen protests of the RMG factory workers in the street and fighting with the police, and police shouting back at them because their wages, as usual, every time what we see is that they always their wages are like let's say like they don't get paid for 2-3 months, and even in this situation there are area salaries that has been paid to them, and there were protests on the street, but no legal cases.
Well, I mean, this is just the beginning, and maybe you know, the impact of this that will have on different kinds of communities across the world will mean that legal cases will be brought in the future. Who knows? Thank you so much for answering those questions. We'll just do Yvonne's final question for Adele, which was some clarification on, it says 480 from 3,000 intended intended children according to DUB's commitment. What can we do to expose the appalling lack of efficient implementation and effective implementation? Thanks, Owen. Adele?
Yeah, so there's the situation for children splits up into 3 different areas. So there's the DUB's commitment, which was to bring children from Europe. There was a commitment from the government about the same time as the 20,000 commitment of people from 2015, particularly Syrians, on the vulnerable people's resettlement, but an equivalent one for children. And then there's Dublin 3 family reunions. And if you bear with me, if I can go through each one of them. So to start with the DUB's commitment, that was based on Lord Dubs and his own commitment to challenge Britain's lack of commitment of bringing children who are already stuck in Europe. These aren't children in refugee camps elsewhere in the world. These are young people who have made the journey to got into Europe, and a commitment to share the support of these young people across Europe. And Britain has actively failed to do very much on this at all. And they reckon, the British government says that they have been successful at bringing in 480, which they say is about the level of their commitment on DUBs. For more information, it's worth looking at Safe Passage. Then there was the 3,000 children. So when Britain committed to bring 20,000 people in on the vulnerable people's resettlement, they made an additional commitment to bring in 3,000 people where the cases were led by children. And we've only had one family on that, or 2 families in Gloucestershire on that commitment, because each of the different areas had to commit to both programs. So what has happened now since 2015, we're nearly at the end of that original commitment of 20,000 and the 3,000. And because of the way the commitments were made back then, and each council had to say that whether they would sign up to the VPR or the children's one. And in the end, we're going to be starting, as soon as that 20,000 is finished, we will hopefully move seamlessly into what's called the Global Vulnerable People's Resettlement Scheme, which means that Britain can accept children, families, individuals, vulnerable people recommended by the UNHCR from any country that UN is working in and are identifying vulnerable people from. So that we will continue to have about 5,000 people a year. This year we will not meet that target, about 5,000 a year, and they will not necessarily be from Syria, but they can be from any of the countries that, as I say, UN is worried about. And so if we have not met the 20,000, I suspect we have not quite met the 3,000, but that commitment in some ways continues. Then there's Then there's the Dublin 3 commitment. Now, some of you will remember that GARAS got a bit burnt with Alex Chalk being one of our patrons, and questions about the Brexit bill and the dropping of the commitment to family reunions, where families are actually within Europe and have the right to be reunited with family members under what's called Dublin 3 agreements. But because we are leaving Europe, because we've left Europe, we no longer necessarily will be signed up to the Dublin 3 Convention. Now, this is coming back into the immigration bill. I'm trying to get a sense of what the government is planning, but it seems to be unclear. Safe Passage are starting a campaign against what the government is currently doing. But again, I haven't been able to get an actual clear message of what the government is planning, other than they are trying to water down their commitments, and they're going to do a country by country commitment rather than the existing European-wide commitment to, if we have a family member here in Britain, the primary carer is here in Britain, that the other people can then join them. So there will be, so please watch out, because there needs to be a campaign to bring those families, those children, those individuals here on whatever replaces Dublin 3 commitments, as the immigration bill takes the place of the Brexit bill, of the Brexit information.
Okay, thank you so much, Adele, on responding to that. And I think Lynn has quite rightly said, if any of our speakers can share any information on how we can pressure the UK government into supporting immigrants, refugees, asylum seekers, those in our country or in other countries.
You're on the picture, Richard.
Following the response to COVID, we would be very grateful, and we're happy to share that as Stride Greens. I've noticed that we're at 9 o'clock. I just want to say thank you so much to all our speakers for joining us, for taking the time and letting us know your thoughts and your research. If there's anything that we can do to get more involved, then please let us know. Stride Greens are more than happy to be an ally to everyone. We hope that attendees have enjoyed the speakers and the discussion following, and we hope that together, you know, we can work collaboratively across this international, you know, perspective that we have, and we can look to places. I know someone mentioned New Zealand in the chat, and you're right, New Zealand seem to have done a lot of things right recently, a great government and a great leader, and there's hopefully more of that to come across the world. Thank you everyone for joining and taking the time, really appreciate it, and hopefully see you at the next Cloud Cafe.